Hi, I'm Dr. Angeline Yong, the Senior Consultant and Dermatologist at Angeline Yong Dermatology. I am the officially appointed Cynosure Asia Pacific Key Opinion Leader and Trainer, as well as a country trainer for Ultherapy. Today, we'll be combining both Ultherapy and Tempsure in the same patient. So these are both great platforms to achieve great facial rejuvenation, especially for lifting purposes. Both achieve a non-surgical facelift, and we're going to start with the Ultherapy platform first. So Ultherapy, or basically high-intensity focused ultrasound, is a modality that goes deeper than radiofrequency. So I like to do that as the first pass. And there are two main depths I usually play around with. So the 4.5 and the 3 mm transducers, we will both utilize in her case. It's very, very good for achieving results in this part of the face, improving sort of like the saggy middle-labial folds, as well as complaints of having sort of like a jowl or pre-jowl area. Tightens the jawline very well. And you'll see later on when we use the Tempsure Envi that is great for full face treatment, but especially for areas where the skin is absolutely thin. So like around the eyelid area, around the forehead where high intensity focused ultrasound isn't great for, and that's when you actually utilize your radiofrequency platform as well. The other thing I do want to mention as well is that with high intensity focused ultrasound or therapy that we're using here, the results are not immediate. The results actually build over time. So we get collagen and elastin remodeling, we get gradual tightening over a 1, 2, 3 month build-up period. Patients must understand beforehand that going in for a high-intensity focused ultrasound treatment or therapy for short is really going to be more for the long haul. Results are great. It can last you a year and a half. That varies from patient to patient and depends on the skin type and the amount of laxity as well. But the reason why I like to combine radiofrequency or the Tempsure Envi in the same setting or one after another sequentially is because the radiofrequency platform gives you more immediate results. So while you're waiting for the Ultherapy results to kick in, you actually start to see that lifting, that tightening from the radiofrequency. So that's really, really great. Ultherapy, as I mentioned, is great for this area of the face. We do that in certain areas of the forehead as well. But it's a technology that goes deeper. So it really goes to do more of the heavy lifting, and radiofrequency can achieve more surface sort of improvements. So we're going to start off with Ultherapy here. So usually what we do is after we pre-cleanse the face, we clean it thoroughly. After doing adequate numbing, what we'll do is we'll actually apply an ultrasonic gel and then apply the transducer. So I have a transducer here in my hand. It's the 4.5 mm transducer, and I've already applied the gel, in this case to the right cheek. So I'm going to fire the first shot now. Okay, how does that feel? Is that okay? It's okay. All right, so it's okay. See, it's actually quite comfortable. So again, adequate visualization. I look at the patient's skin, and then basically based on the visualization, if I'm at the right depth, I would then fire. If you're not at the right depth, you're not going to get the good results that you want. So it's very important that you actually visualize as you go along. And that I feel is the superiority of our therapy compared to standard HiFU devices. After I finish this segment of the face at 4.5 mm depth, I'm going to switch out. I'm going to pause the treatment. And then basically, I'm just going to switch to the 3 mm transducer and to complete the treatment. The other thing to mention as well about therapy is that there is that sort of like post-treatment swelling that you can expect. So on the day itself, they go back feeling a little bit red, but again, it doesn't break the skin. There is no breakage whatsoever, so there's no surface crusting. There is no downtime from that perspective. It's absolutely still considered a no downtime treatment. You can walk out today feeling a little bit slightly more puffy, but it's barely noticeable. What you feel though over the next few days is sometimes a little bit of aching sensation, especially around the jawline area. So now that we've completed the Ultherapy treatment to the middle part of the face, so the mid-cheeks and the jawline area, which is a great Ultherapy location and zone, we're going to move on to demonstrate the Tempsure Envi, which is a great exciting device. It's absolutely great for the periorbital skin. So you can see that she's got some laxity over the lower eyelid, some fine lines as well. And definitely, sort of treat the forehead at the same time because it's an area that will achieve like a little bit of a brow lift as well when we tighten this area. This is a very comfortable treatment. It basically feels like a hot stone massage. It is the first radiofrequency device to actually have contemporaneous real-time temperature sensing. So you're able to sort of like directly have feedback with the temperature monitoring as well to know that you are hitting the right sweet spot. So what we really want is to get the temperature heated up to between about 40 to 42 degrees. That's a sweet spot to really achieve a lot of tightening of the collagen tendrils. We're going to set this for a 5-minute treatment on one side and a 5-minute treatment on the other side. So that's usually adequate for like a small zone like the periorbital area. Now, when I combine it with Ultherapy, I will do Ultherapy first sitting, and then I will follow up with the series of radiofrequency treatments with the Tempsure Envi. And what you find is that as you wait for the Ultherapy effect to kick in, your radiofrequency is already starting to show, and you get multiplanar improvement because you're working on the more surface levels with radiofrequency, harder to treat areas with radiofrequency, such as the periorbital skin, and at the same time you get the dip lifting from Ultherapy. I think that both platforms are very synergistic. I like to use them together to get full face rejuvenation in the patient. Now, the good thing about the Tempsure Envi as well is that my device here also is a Vitellius, so it also is able to treat some of the harder to treat areas. It's good for female genital health, but also can be used to treat cellulite, to be used on the trunk, on the upper arms, to improve laxity in these locations as well. So it comes with bigger handpieces that can be changed. Now, when we are here in the eye area, we're using a 10 mm handpiece, which is a small handpiece to fit into very small areas. But on the body, you can be using 30 millimeters. So now here we complete the treatment in this location, and then we're going to ask the patient how she feels. How was that? It was nice, very relaxing, very comfortable. Now, if it's a longer treatment to the whole face, typically the patient can end up drifting off. I always like to start with energy-based devices. So I tell patients that for lifting or for full face rejuvenation, it's always good to start with a platform like Ultherapy, like radiofrequency.